Doctors of Reddit, what patient made you go? How the are you even alive? I was on home call for in a small town. Got a call from the nurse one night and she was like, "Ems brought someone in here and they think she might be dead." I was like, "Well, is she?" She was like, "I don't know. ... This was a seasoned RN, by the way. So I was like, "Well, guess we're treating this as a code blue kind of situation." So without any further information, I jump into my car and rush over to the hospital. Once I got there, I realized why the triage nurse was so confused. In the trauma bay lay what appeared to be skeletonized remains under a blanket. The person felt warm to touch. So I opened their eye. And a yellow, wrinkled, shrunken eyeball stared at me and then suddenly moved. Potassium of 1. For those familiar with lab values, the backstory was extreme self-neglect, depression combined with caregiver neglect. Weighed in at 67 pounds at a height of about 5 feet 5 inches. We actually resuscitated her, very aggressively, and unbelievably, after about 8 liters of fluid. She started speaking a word or two at a time and recognized her daughter. My mom's a doctor. I asked her about this when it came up on Reddit. When my mom was in her ICU cycle during internship. Man with police officers behind him came in the ICU. The man was perfectly fine and walking. So my mom and her colleagues were confused. The officers showed them a picture of a crumpled metal piece. Which was a car. It didn't look like a car at all. Just metal trash. The officers told my mom and her colleagues that they rescued the patient from the car, which was lit on fire only a few seconds after they rescued him. The patient didn't have a single scar on him, was perfectly fine, and got his name around the hospital for being immortal. Patient here. When I was 2, I was being treated for asthma due to wheezing, labored breathing, etc. One night it got exceptionally bad, so my mom took me to the ER. They put me face down to do a CT scan. This was 1990. And when they were done, they turned me back over and I was blue. Had stopped breathing. CT revealed a volleyball-size mass in my chest. Emergency surgery revealed the mass was what would have been my twin. It kept growing inside my rib cage and finally had nowhere to go in my toddler body, so it cut off my airway. It had fingernails, hair, appendages, everything but major organs. Made a full recovery. I am a healthy 31-year-old now. Zero asthma. Only remnant of that night is a scar that goes from the center of my chest to the center of my back. Update. Definitely didn't expect this to blow up. Thanks for my first gold. This was a teratoma. So it was never a viable human. Edited the post to show that I am the healthy 31-year-old. Lol, anybody that quoted Dwight Schrute is my hero. A guy the first took care of during my residency, cyborg. I was the chief on trauma. Got a page about a patient en route with a stab wound to the chest. When the patient rolled into the trauma bay, he had no pulse. He had been stabbed in his left upper chest, 3 centimeters below clavicle. He got an orthoracotomy, if you want to feel like a badass. Then do an orthoracotomy. We were able to cross-clamp his aorta. We took him right to the OR. We oversewed one small artery below his rib. Then transported him to the ICU still intubated. 8 hours later he was extubated and wanting breakfast. Seriously. Dude? He was dead 10 hours before. He was also a complete. No wonder someone stabbed him. Airlifted pregnant female with GSW to the head. Arrived intubated and non-responsive with the bullet lodged in her right occipital lobe. Self-extubated the next day and left the hospital against medical advice 2 days after that with only minor visual deficits. Unbelievable. I have a hospice patient that has been on our service for 4 years. I am either really great at hospice, or really bad at it. My father's doctor couldn't believe he didn't need to amputate his feet and he was still alive. Dad had brittle diabetes. His pancreas would kick in and out due to a congenital deformity. At 82, he had significant heart issues, including angina, enlarged heart, and clogged arteries. One day, his feet went black, not just bluish or gray, black as charcoal. Rushed to emergency. We were told they would amputate, but to say our goodbyes. Dad refused surgery. Said he'd rather be dead. At his age. Hours later. His feet were pink. We took him home that morning. Doctor actually apologized for upsetting us. But said he'd never seen anything like it. A guy. Now passed away who had incurable lung cancer from Agent Orange exposure during infantry service in Vietnam, and his wife had recently died. Cancer. Wife died. Guy was pretty positive, glass half full about chemo, considering the double whammy. Asked him how he managed to keep it on the positive. He said he was returning to base with just days left on his enlistment. Rookie pilot has a mechanical failure of some sort in their Huey. They are going down. And not the controlled kind of landing either. He assumes he is about to die. Says everything got real slow. Real bright, and a sense of acceptance and peace washed over him. Rookie pulls one out at the last moment. Lands their bird with no casualties. Patient told me he felt he should have died that day. And every single day since was a complete gift. Maybe being alive has a lot to do with attitude. Obligatory, not a doctor. But my dad is, and he liked to tell us about the crazy he saw. This post made me think of one of those in particular. Huge guy. Linebacker build. Came into the trauma ward with a gunshot wound dead center of the chest. He could breathe fine and he had a pulse. So they did a chest x-ray and found that the bullet had spent all its energy getting through this guy's sternum and was just resting on his pericardium. I'm a psychologist, not an MD or DO. But I work at a psychiatric hospital. Anyway, one of my patients a few weeks ago was a 15-year-old boy who was regularly neglected as an infant by his mother, who was an addict. When he was around 5 years old, his mom pimped him out to men in return for drugs. When he was 9, his stepfather gave him a skull fracture after beating him with a wrench. When he was 14, the same man shot him with a pistol for talking back. He's in foster care at the moment. And suffers from PTSD and depression. But he's the sweetest boy I ever met. I wish him the absolute best in life going forward. He deserves it. Veterinarian. Dog hit by a train. It severed the dog's leg and the dog carried its own leg home. Owner brought dog and leg to the earth. Edit. Leg could not be reattaches due to significant damage to limb. Dogs do great as tripods though. Currently in residency. But this was a patient I saw in medical school. This one has more to do with a patient's past medical history instead of anything acute. Had one patient in one of my internal medicine rotations who was admitted for hip surgery, who was one of the nicest, sweetest people I've ever met. Her surgery was pretty routine and there were no complications. In her past medical history, she was diagnosed with stage 4 endometrial cancer that had spread to her brain. Apparently she had undergone chemo, radiation, primary tumor resection, and surgery to remove the brain met. She remained cancer-free since that period. The fact that she had undergone that whole ordeal and appeared to be mostly healthy and was in remission from her cancer really blew my mind. My mother. We used to live in East Texas and my mom had this lady come in whole, had a huge infected wound in her leg. Like massive to the point they might have to amputate, and she had asked her why she waited so long before coming in when it was obviously festering. Well, turns out this woman was letting her dogs lick it clean because their mouths are clean, and she was soaking it in Dr. Pepper because doctor had her thinking it would help. Needless to say, my mother looked at her like a deer in the headlights when she said that. We had one of these at an eye doctor's office of all places. Patient was complaining about how her new glasses weren't working. So the doctor took her in back to check to see if the prescription needed tweaking. The doctor came up with a completely different prescription. Patient was overweight but claimed she was not diabetic. The doctor convinced her to let us take a blood sugar measurement with a staff member's personal glucose meter. All the meter displayed was high. With some arguing, we were able to get her to go to the local hospital right away. I don't remember what her blood sugar level was. But I remember it was the hospital's high score for a while. She should not have been conscious, let alone functioning normally. Patient here. When I was 7 I had horrible asthma. My mom often lied in my bed with me and listened to my breathing. One night she fell asleep and jerked awake in the wee hours of the night. And found I was not breathing. Minutes away. Not sure what happened while there. What tests they did. But I was declared dead. In the morning I woke up. Asked who I believe was a nurse where I was. And she started crying and called in my mother, who hadn't slept all night. The doctors said they didn't know how I was still alive. Now 16 and haven't had any hospital-worthy complications since. And got it. My mom is the most amazing and loving person on this green earth. I had a patient who was literally cut in half at the pelvis after a car hit him and pinned him to a telephone pole. Paramedics carried his legs in separately. He was wide awake and talking to me as we quickly put in a central line, and he got all the bleeders ligated by like 5 different surgeons. He declined pain meds repeatedly. What a legend. He was in the OR 5 minutes later. Luckily this was at a major academic center with an exceptional trauma surgery team. Apparently the guy lived. Not sure what his quality of life was after. But pretty crazy. I had liver failure. When I was 8 months pregnant. My baby had stopped moving for several hours. So they did a C-section. They found out during blood work that my liver had failed. I almost needed a transplant. I bled so much that my body used up all its clotting stuff. I was in ICU for 3 days. In hospital for 2 weeks. My liver recovered. I went home with my son. We could both have died. The hepatology department and maternity department were working together. Which is not a usual thing for them. Edit. It was acute fatty liver of pregnancy. Obligatory, not a doctor. I'm a funeral director and I received the body of a 90-something man. I could tell he had been sick for quite some time just by looking at his face. Another funeral director did the embalming. So I hadn't seen the rest of his body. Seeing that he was so old and just looked sick. I was surprised when I met with his daughter and she inquired about an autopsy. I asked her my usual questions and discovered that this man, for 40+ years, had unregulated diabetes. He was shot on 3 different occasions in his life. He had a history of strokes, bed sores, deep ones, in and out of the hospital for sepsis, pneumonia, heavy smoker, heavier drinker, suffered a major heart attack just days before. His vision was going and he couldn't keep himself awake. Horrible jaundice, cirrhosis, had an infected kidney removed. On and on. I don't think this man lived one healthy day in the last 20 years. I asked the daughter, "So, you want an autopsy because…" Quote. She tells me that her father was not an ill man and it was not his time to go. She's furious I even questioned her request. I'm baffled that this man lived for 90+ years. The denial people can experience in hand with grief is astounding. My friend in nursing school was in charge of checking in and out a habitual patient that also was seen by a full nurse and doctor. On checkout she noticed a bandage on the guy. "Oh, that's for my hole." The guy had an open sore that kept getting bigger and bigger and he had stuffed 3 t-shirts in it. He had been having repeated health problems and they just listened to his lungs. Would give him an antibiotic and treating him. I had a patient in the emergency room who had been involved in an awful car accident where firefighters and paramedics spent an hour trying to get him out of his car. Reportedly, he attempted to walk to the ambulance and when he arrived he was awake and talking. Confused speech. But still. Then paramedics signaled the back of his head to me. His skull was popped open on the back so much that I could see inside. We paged the brain surgeon immediately and the patient was taken directly to the operation theater. Months later I heard from my colleague that he was still alive and had no damages other than some occasional balance problems. 2 patients that give me faith in what medicine can do when I think about it. Both quite young to be so sick. First was a woman who was very pregnant and some genius doc agreed to put her under twilight anesthesia for an elective procedure that definitely could have waited. Went into labor while she was under and from there had everything go wrong, ended up in cardiac arrest. Was transported to my hospital and put on VAECMO. She was in rough shape when I saw her first. Most people in her condition don't make it. I ended up seeing her a month later walk into my op clinic and I got the creepiest feeling. It was like seeing a ghost. She was fine. Not like most people who come out of the ICU after that kind of stay. The second was a young guy who bled out in the ICU of a sudden hemorrhage. He was pulseless for an hour. Without going into a bunch of details. He required several procedures after that which were risky on their own. It took weeks for him to reboot. But eventually he was responding to stimuli. After a couple months he walked out of the hospital. He wasn't dying. He was dead for an hour. That these two survived is a testament to modern medical science. That they walked out of the hospital on their own, needing little to no assistance, and with their cognition completely intact. That is a miracle. Edit. I remembered another one that was pretty wild. This guy had very advanced cancer which had invaded the major blood vessels of his abdomen and chest. When they took him to surgery, his vena cava was involved and it sounds like it just unraveled. They were not ready for a major cardiothoracic procedure, so they were just dumping blood products into him to keep him alive while they could get someone to repair this major vessel. I thought the op report had a typo because they said the estimated blood loss was 30 L. I forget the breakdown, but they had put hundreds of units of blood. Liters and liters of crystalloids and plasma. It's about 6x the blood in a normal person. He was white as a sheet for weeks after this, but he made it. So not the doctor but the patient. I had a super bad allergic reaction that was a specific type of allergic reaction that was deadly on its own. It would have been deadly if I had only taken a small bit of the medicine I was allergic to, but the doctor that prescribed it accidentally prescribed about 10x more than what the maximum dose for that medication is supposed to be. So not only was I super allergic, I was also overdosed on what L was allergic to. So that lead into weeks of me being in the ICU and doctors thinking I had about a 3% chance of surviving at best. Every time I was conscious and had family visiting, a doctor would tell me to make the most of it because I probably wasn't going to make it for their next visit. Eventually I somehow recovered, but for about 2 years after I was still regularly going to several doctors to make sure different things were okay that were affected by it. Every single doctor I went to would hug me and would have other doctors and nurses come in and say something like, "Hey, you don't remember this because you were unconscious at the time, but I helped restart your heart." Or, "I was the person that vacuumed the blood and pus out of your throat that was blocking your air path." And they were just all amazed that I made it. It's been about 8 years since it all went down, and I've run into several of the doctors and nurses around the city and they still recognize me and still hug me. It amazes me how in such a large city with such a huge hospital that gets the most extreme medical cases from around the world that they still remember me being there. As a med student on my emergency rotation, I had a guy brought in who had fallen off a 7th or 8th floor balcony and landed on his head. Essentially DOA, and we couldn't get a blood pressure when he got to the hospital. As a student, my job was to basically stand to the side and squeeze the bajillion bags of blood that went into this dude. His cervical spine was essentially dust on the initial CT scan we got. I figured he probably wouldn't have made it, but about a month later I'm now on my ICU rotation and I see this guy awake and conscious. Pretty crazy. Not a doctor. But was the patient. When I was in boot camp, one developed an upper respiratory infection during second phase. I didn't want to get dropped back a platoon, so I gutted through. Got back and went to sick call where they treated me for a host of things. When they x-rayed my chest, the doctors came out with my films and literally asked, "How the hell are you still alive? Your lungs are so full of mucus you should be dead." Turned into walking pneumonia at some point. I also had athlete's foot that turned into cellulitis and my last wisdom tooth yanked. So the combination of meds they had me on was enough that I don't even remember that week at all. Type 1 diabetic in their 20s presented dead of DKA, unresponsive. No pulse. In VF. Multiple rounds of CPR. Defibrillated. Eventually stabilized in ICU. Self-discharged immediately after being extubated less than 48 h later. Doctor. Oh my goodness. So many patients. Too many to tell. One good one. I once took care of a guy in the rural South who came to the hospital because people said he was growing salt. And he was totally covered in what looked like snow. Uremic frost. I said. Since I was fresh out of residency. Guy had been in renal kidney months and had been vomiting every day, which kept his potassium low enough that he didn't die. But it was still 9.7 and his ECG was a sine wave and he definitely should have been dead. Google uremic frost. It's a good one. EMT here. Brought in a PT whose, now former, girlfriend stabbed him in the face with a chef's knife. The knife went through his right eye. Missed his cranial cavity. and stopped about from his brainstem. The X-ray was nuts. We showed everyone. I'm a hospital medic and my first serious trauma was a guy that got shot in the neck. Somehow it missed everything important and went right through. Minimal bleeding. No C-spine damage. Just a hole through his neck that didn't pierce his esophagus, trachea, or any major vein or artery. Dude was just chilling in the room. And then 2 weeks ago we had a gunshot that would not have made it to the local trauma center. Hit his femoral vein but was still gushing blood. One nurse stuck her finger in the hole and it stopped the bleeding. And I found a second wound in his chest. No bleeding at all, it just looked like a weird indentation. We couldn't even tell it was a gunshot at first. And I stuck an IV adhesive sticker over it to vent it and prevent a collapsed lung. The guy's blood pressure was in the toilet and wasn't even able to read on the machine. We needed a manual check. By the time we got him sort of stable and with decent vitals. And got a surgery team in early. We were drenched in this guy's blood. Pretty sure most of what was flowing through him was saline and other people's blood. He survived though. We also had one woman whose entire abdomen was fully open under her belly. And everything in her was horribly infected. We basically told her we can't stop that much infection and she opted for hospice care. She was in so much pain I don't know how her family even got her to the ER. I lifted up her gut to look underneath since I was the first in the room to assess. And I was hit one of the most rancid smells I've ever experienced. Literally everything from the waist up was infected. There were some unnatural fluids draining right out of the completely open bottom of her stomach. I mean it when I say you could just lift it up and look right inside. I'm not a doctor but I did meet a patient who fell from a 5-story building. Landed on his upper back. Woke up in the hospital the next morning and got up walking around like nothing ever happened. Barely a scratch on him. Think about it every time I'm in a building with at least 5 stories. Just looking down like how in the world did this guy walk away from that like he fell off his bike and took a nap. Actually. Not a doctor. But I had a few doctors ask me that. Typically, if you get appendicitis it'll rupture and sepsis will set in within a day or so. And when that happens, it gets real bad real fast. So I got appendicitis. It freaking hurt so bad. But I didn't know I had appendicitis. I went to the doctor. He couldn't tell what was going on. Though I had compacted stool and wanted me to take stool softeners. So I did. It didn't help. Cause spoiler. It was appendicitis, right? And then a roommate who thinks he knows what he's talking about tells me that it's all in my head and I just need to physically get off the couch and exercise. Because he feels much better after he exercises. Okay dude, I can't even get off the couch to use the restroom without almost passing out in pain. He tells me to just play a video game to get my mind off of it. I go to class, grad student at the time. I call the doctor and make another appointment. He doesn't know what's going on. I talk with another doctor. No clue, he thought maybe it's appendicitis. But I didn't have a fever and didn't have a recoil pain. So maybe it was gastrointestinal stuff. So I schedule an appointment. Meet with them. All the while I'm going to class and taking the maximum dosage of all pain relievers I can get my hands on. And finally the GI doctor's scans showed that I had appendicitis. Hooray! I go to the nearest ER and I say, in a totally calm tone, "Hi. My name is less than insert name here, greater than. So. My doctor said I should probably go to the ER because my appendix burst a while ago and it should probably be taken out or something." Turns out, my appendix burst and I held onto it for 3.5 weeks. I had a dozen doctors come in. And some of them even started by saying, "Hello. My name is Dr. Such and Such. And I heard that you're the guy who has had a burst appendix for nearly a month and you're still alive. I am not on your case. But I just wanted to meet you. How the hell are you still alive? How the hell did you drive yourself here and just waltz into our ER? I got that alien bioengineering upgrade where the abdominal moves around and wall seals off the burst appendix so it doesn't leak everywhere." Edit. After my primary care physician learned I had appendicitis and he didn't diagnose it. He retired within the month. It was probably coincidental. I had lost a lot of blood to anemia and went into the doctor for something else. She starts looking into my eyes, my gums, pinching my cheeks and telling me that I'm several anemic and then said, "Are you always this white and pale?" And then I'm like, yeah, I guess. And then she made me take a test. Turns out my blood level hemoglobin was at 6.5 and dropping because of my heavy menstrual cycle and stomach issues not absorbing iron. I had gone into the doctor because I had really bad heartburn. And turns out that I was really low on blood. It explained all the dizziness, coldness, eating ice by the pound. Auditory hallucinations were happening and I started to just not care about anything. Had numbness in my whole body as well. And trouble breathing. I'd been in such a dire state that I started to accept all of these things as normal. When I checked myself into the I told them that my doctor told me to come in. But I think she was overreacting. And I can probably just go home. They quickly tested me. My blood level had dropped a little in a couple of days and I still had heavy menstruation. They quickly admitted me to start my blood transfusion. They said that had I waited I would have likely gone into cardiac arrest or would have just died in my sleep. After the blood transfusion I felt amazing. I could breathe and my skin color was back. I'm a midwife and we have patients who have massive obstetric hemorrhage (MO), which is classed as any blood loss over 2 liters. This can happen for a variety of reasons. We had a patient who unexpectedly started hemorrhaging following an uncomplicated normal vaginal delivery and we just couldn't stop it. As soon as we pumped blood in, it hosed out. The doctors had to perform an emergency hysterectomy and the bleeding stopped. I think it's fair to say we were all shocked not just at the incident itself, but at the fact that this woman lost 8 liters of blood. Also, that she spent just 1 night in intensive care before she was back in the ward, caring for her newborn. And she was home within a week. Women are bloody awesome, excuse the pun. For reference, women usually have between 0.2 liters of blood circulating in their body. Hence 8 liters is very scary. 35Y0 male. Casual plasma glucose was 600. The guy came for a slight headache. Lady in her mid-30s was in the clinic for a 1-week follow-up post-foot amputation, diabetes. She was admitted straight from the clinic because her blood glucose was 600 mg per deciliter, normal as 80 to 120. And the wound was severely infected. We used super concentrated doses of insulin to bring it back to the 200s. She was on strict diet restrictions and we couldn't figure out how it wouldn't drop any lower than 250. Turns out her kids, teens, had been sneaking giant 64 ounces sodas and candy bars into the hospital. Literally 1 week after we chopped her foot off because of uncontrolled diabetes. Not exactly a case of how the did you survive that trauma disease, but how the do you even function on your own? My sister was the patient. But every doctor who's gone through her whole file has had this reaction. When was 9, she fell around 35 feet off a bluff and landed head first on bedrock. Shattered every bone in her skull. A very well-known neurosurgeon took a look at her when she was brought in. Said, "Sorry, there is absolutely nothing I can do for her." I'd say she had a 10% chance of surviving the night. Say your goodbyes now. 3 weeks in a coma. 3 months in an ICU. 6 months as an inpatient. She's still alive today. She has permanent damage, of course. But holy cow, can kids' bodies recover from a lot. I work in trauma and once had a guy fall off a roof. He said he remembered hitting the bars on the scaffolding on the way down. We originally thought he'd fractured his femur, but nope, just a small hematoma. He was in bed next to a man who had broken his ribs and had a small C-spine fracture when he fell forward picking up his keys. A couple pictures of me before and after brain surgeries were on the front page around this time last year. The mortality rate for acute subdural hematomas is 50 to 90%. Of those who live, approximately 20 to 30% regain any brain functioning due to the subdural hematoma. The bleeding in my skull was so severe that I also had cranial herniation. Millimeters, causing my brain stem to compress into my spinal cord. That I not only lived, but woke up and recovered well enough to go back to work, get married, travel the world, return to baseline physically as a straight-up medical miracle. I'm still in touch with the neurosurgeon who was on call at the hospital that day. And he says the same thing. We had a guy with a major aortic dissection one night. From the bedside ultrasound, he looked like he had already bled out. He had some chest pain, but he was alert and oriented. And we were shocked he was even still alive. He absolutely shouldn't have been with how much blood we saw and the size of the dissection. We called the surgeon in, who was really blunt, and explained to the guy he was probably going to die in surgery. He was a young guy, like late 40s. He was on a business trip, and it was completely unexpected. He kept trying to call his wife, but it was like 2 a.m. and she wasn't answering. He just wanted to talk and tell her goodbye. It was actually pretty devastating to watch. Meanwhile, he's so coherent and alert, as if he isn't actively bleeding out and dying. Most patients we would get in the same situation wouldn't be conscious or would already be dead. They swooped him off to surgery before he could contact his wife. And the dude lived. Remembering that story got me through a lot of tough years in the ER. Because I think it just reminded me that hope and good outcomes are still out there. My dad is 87. He had prostate, liver, bowel, colon and skin cancer. For the skin cancer, he had lots of reconstructive surgeries. His whole tibia region and the back of his hands. Closing parenthesis. Every year he has to have at least one skin lesion removed. He had a couple of heart attacks and then a sextuple bypass surgery. He also had a big pneumonia, a huge abscess and a small stroke. His doctor wants to see him every 6 months. I think just to be amazed that he's still walking around. During residency, my ICU patient had to have his chest reopened less than an hour after 6-hour open heart CABG surgery. He needed 12 units of blood. Times. Cardiothoracic surgeon in the ICU operating because no time to go back down to OR. Was an illicit drug abuser and alcoholic. Nurses called him the cockroach. I checked in on him for 4 weeks. He was unresponsive every day. On week 20 we had to consult and to take maggots out of his nose. I was sure he was a goner after that. Week 3 passed. No change. Week 4. Day 24 I believe. At 6 a.m. he opens his eyes. I was shocked. He has a permanent track and ostomy now. But somehow is alive.